Epic is placing total patient care at my fingertips.
Epic is providing exceptional patient care, 2 patients at a time.
Epic will be a huge advantage not only for patient care, but for research.
MyChart is going to be able to improve communication between the patient and the physician, which ultimately will improve patient outcomes.
You can communicate much more efficiently and then save the time that the nurses and the physicians are calling patients to be more of those real personal one-on-one conversations that need to happen.
It'll cut down on nursing calls back and forth to parents and patients. People will be able to do it at any time of the day. They won't have to wait till our business hours to ask that question that's on their mind.
From a patient and family perspective, MyChart is going to ease some of the frustrations that some parents may have when they want to access simple things in the medical record, such as immunization records or things like that. It's going to allow them to be able to simply log on and retrieve that information very independently.
It gives the patient access and control of their own health care. It really empowers that patient to become a part of their own health care and to be a driver of their health care rather than a passive participant.
Eventually it will go through lab results. It'll be a direct communique between the two sides. All of this to effectively give you a better experience.
Care Everywhere allows the advantage of those patients that are not only here maybe in the community, but are coming from outside of the Houston area or even outside of Texas. Be able to allow our physicians to gain access to their records at a much quicker rate. If they've been seen by a facility that has Epic as well, it can be done in a few seconds and can be transmitted directly into their chart.
We are a major subspecialty area within the city of Houston and the state of Texas, so there's a lot of patients that are transferred here, and part of that battle of transferring them the first couple weeks that we're trying to get them here is really getting their record with them, so this way we'll be able to get it when they arrive here.
If you have an unconscious patient, if you have a patient who has any type of communication delay or problem, you don't have to depend on them to tell you those things, but rather you can see what's in the chart, what medications they've had, what treatment they've had, and that allows the physician to make better choices on how to treat that patient moving forward.
If we have a system where we can just tap into an electronic system and regardless whether the patient is displaced or usually sees other providers, we can get access to that, that will really improve patient care.
Change is inherently stressful, and I know that there were some significant concerns about Epic when it was initially rolling out. But now that the providers are becoming more and more familiar with it, I hear a great number of positive comments about the value that it offers to us as healthcare professionals, and more importantly, the value that it provides to our patient.
I can't imagine that the electronic medical record is going to do anything but exponentially improve quality of care and safety. I just can't contemplate otherwise.
It's not over yet. We have multiple go-lives yet to go, and I think we still need to rah-rah Epic and keep that cheerleading impact going.
We are going to be the preeminent children's hospital in the country.
It's going to give us opportunities to do things that very few institutions can do.